sorry. If everyone's okay, we're going to record the meeting for delegates who can't attend because of different time zones. So if you don't want to be in the recording, just don't turn your video on. Yeah, so this is what we're going to cover today in our 1 hour session. We're going to be talking about why it's so important to be acting on climate change and health now. We're also going to be talking about the health impacts of climate change, the health co-benefits of climate change, which is a really key point for policy making. And then we're going to go through some simulations of policy making and how it relates to health. The first one being COP26 and the second one being a local government initiative. So hopefully we'll give you like quite a good sense of not only the knowledge, but also how you apply that knowledge to policy making and on climate change. So if you go to the next slide, please, Omnia. So because of who will be attending this conference, I'm going to maybe shorten what I say on this slide, because obviously you're all here because you know the seriousness of the issue and what we're dealing with. And I just wanted to talk about how the health impacts of climate change are already being seen. And I think that's something that is a narrative that we're all working to dismantle, that climate change is a problem for the future. But I think, yeah, for example, nations across the world are already suffering from the health impacts of climate change. These changes include extreme weather events, malnutrition and diarrheal diseases due to food and water insecurity. Across the world, there was a 77% increase in populations being exposed to wildfires between 2015 and 2018 compared to 2001 to 14. And so these wildfires have a huge impact on physical and mental health and are directly attributable to climate change. We've also seen an augmentation in the incidence of severe drought. For example, parts of Brazil experienced severe drought for the entire 12 months of 2018. And in countries like the UK, we saw 900 people were killed by the heat wave in England in 2019 alone. So really serious issue to be talking about, climate change in general, but also the specific impacts on health. And of course, why we're all here, this is an incredibly pivotal time for action on climate change, and it's really important that we use all of the tools at our disposal to be as effective advocates as we can be, with, of course, COP26, but also multiple countries implementing COVID-19 recovery packages, which have huge impacts on the economy and on health. So with that introduction, I am going to hand over to Omnia, who's going to talk a little bit more about the specific impacts that climate change has on health that you guys should know about.
Okay, now you can hear me. So thank you so much for this wonderful introduction. And I think now 2020 is a really, I would say, special year for us to see such tangible and devastating impacts of climate change on human health. I would say that for many years it has been hard to really explain what is the link between climate change and health, and it seemed a bit abstract. But now more than ever, we can realize that these impacts are felt every day, and this year proves how we're feeling them. And today I just want to share with you this diagram, which is actually my personal favorite whenever I want to explain to anyone what are the impacts of climate change and health. So really, it's kind of the easiest way to explain to someone who would ask you, okay, what is climate change? What is it linked to health? Is by seeing that it has both a direct and an indirect impact. So the most obvious, and the one, as Rhiannon mentioned, that we are seeing all over the world is the increasing happenings of extreme weather events, such as flooding, storms, hurricanes, wildfires all over the world. And it's really easy to say that such extreme weather events would directly lead to injuries and fatalities and death tolls in many countries. So this is a very direct impact due to climate change related events. The second one, which we're seeing in many countries, especially in Europe, as well as countries that are not used to such increasing global temperatures and heat waves. And such heat waves can directly lead to heat stress, can also lead to cardiovascular diseases, because when the temperature increases, this increases and affects the blood vessels, and this leads to cardiovascular failures. As well as it's very related to occupational health hazards due to increasing temperatures and heat waves. Another very important impact due to food security, as well as water security. And we're seeing that in many countries, and due to the increasing temperatures, this is affecting the crops, leading to crop failures, which ultimately leads to malnutrition. And this is predicted by the WHO during the last COP24, so 2 years ago. They predicted malnutrition to be one of the biggest health impacts of climate change in the future. And malnutrition is also really disproportionately impacting several age groups, for example, the elderly as well as children. So it's really one of the most important impacts of climate change on health. In addition, there's a rise of infectious diseases due to water pollution, and this leads to diarrhea as well as harmful algal blooms. Another very important impact of climate change, and we are seeing this more than ever due to, as you all know, how the climate movement started with Greta and how school children are now striking for climate change, which really impacts their mental health because now they feel anxious, they feel helpless. And this leads to many mental health impacts directly related to climate change. So you can see anxiety, despair, depression, but also due to loss of loved ones due to extreme weather events. This can also lead to PTSD, which is post-traumatic stress disorder. And not just loss of loved ones, but loss of jobs, loss of income. Another interesting impact due to climate change is climate migration. And as you can see, because of the weather events, this leads to many environmental refugees and being displaced either due to weather events or due to conflict, civil conflict, due to lack of natural resources or their scarcity. And then also adding on to the point where we mentioned water and food supply and water pollution, there are waterborne diseases like cholera, cryptosporidosis, and so on. Another very obvious link when we're thinking about climate change and we're thinking about human activities which lead to climate change, so we're automatically thinking about pollution. And pollution leads to increased allergies. So you can see a very evident increase in respiratory asthma, allergies, and poison ivy. Another interesting link, and now we are exploring that more than ever, which is the link between climate change and zoonotic diseases. And I'd like to really say it in a more, scientific matter, the link between human activity, which leads to, as the United Nations Environment Programme mentioned in their article when they were trying to discuss the interlinkages between climate change and zoonotic diseases, as we are now experiencing a global pandemic, which is COVID-19. And it's really proved that the link between climate change, human activities, and zoonotic diseases is proved. Not necessarily COVID-19, but in the way of how vector-borne diseases are now increasing due to increasing temperature and increasing capacity of vectors that lead to malaria, dengue, encephalitis, and other infectious diseases, but also because of how now we have zoonotic diseases increasing because of deforestation and bringing in animals and human interface closer. So this leads to increased zoonotic and vector-borne diseases. And finally, and most prominently, is the leading killer of more than 7 million people every year, which is air pollution. And air pollution leads to respiratory diseases, leads to cardiovascular diseases, up to lung cancer. And now we can see that there is, a possibility for cleaner air, and I'm going to leave that for my co-facilitator to explain more about how we can work on this. But just remember that 7 million people die every day because of air pollution. And this is an urgency that we need to address. And this is not just the only way climate change and health are interlinked. Another very important linkages we need to consider, which is the socio-economic dynamic. And again, this is another very obvious diagram that explains to you. Here you can see the direct impact of climate change on health through extreme weather events, the indirect ones which we have discussed, and finally the social dynamics, which really shows how climate change as COVID-19 is a multiplier of health inequalities. Because, for example, the impact on climate change on health is very gendered. Women are more impacted due to such social dynamics, as well as age, socioeconomic status, public health infrastructure as well. So finally, it is a crisis of inequality because of different social dynamics ranging from gender, age, and socioeconomic statuses, those who are in most vulnerable settings are more severely impacted by climate change impacts, as well as you know, the global disparity in terms of low emitting countries are more impacted, especially small state islands, that they are experiencing the health impacts most, even though they are the least carbon emitters. So now I'm going to leave the floor to my co-facilitator to look on the bright side and think about the health co-benefits to climate action.
Great, thank you so much, Omnia. And also, if anybody has any questions along the way, please do just put them in the chat, and we can just answer them as we go along. So I think, so we've talked about from Omnia the consequences of not acting on climate change for health. So we know that we need to act on climate change in order to avoid causing or exacerbating this health crisis, which is going to result from climate change. But one of the really key things to understand about the interlinkage between health and climate change, and something that's really, really useful in advocacy and in policy making, is understanding how acting on climate provides a window to improve health more generally. So there's two parts to this, and we're going to talk about this. So number one is that the factors that are causing climate change, like biodiversity destruction, which Omnia has talked about, burning of fossil fuels, so all the activities that are causing climate change are also really bad for people's health. So even if they weren't causing climate change, these things are actually damaging health anyway. And by removing lots of these causative factors, we can improve health. The second aspect is that not just by removing these things, but through climate action, we can improve health. So you can make policies that, for example, decarbonize your energy sector, but also bring health benefits to including communities who have been left behind, who have been suffering from air pollution. So if we kind of think about it, so we've done what we should be worried about, you know, what are going to be the really negative impacts of climate change on health. And now we can think about the co-benefits of acting on climate. So we're removing negative impacts on health in the future and now, but we can also use climate policy making and climate action to improve health. And we're going to go through a couple of examples of how this works. And I would really recommend kind of getting your head around this concept, because it's a fantastic tool for bringing policymakers on board. And yeah, because people, I mean, people vote on climate, but they also vote on health, especially now. So lots of policymakers are quite hot on this. So in the context of climate change mitigation and adaptation, co-benefits is a term that's used to refer to the health advantages of reducing greenhouse gases and climate altering emissions. So it's a kind of like a broad term, which basically means it's like the added extra and the bonus, except what we want you guys to think of it as something that you integrate into everything that you do. So whilst it is an added bonus to emissions reductions, it's also something that you can integrate into policy making and into action as well. As we said, this is because the drivers of climate change are also the drivers of ill health and health inequalities. So for example, the combustion of fossil fuels is the primary contributor to deaths in the UK from air pollution. And this disproportionately affects deprived and vulnerable communities. So even if this burning wasn't causing all these horrific greenhouse gas emissions, it's still causing air pollution, which is really affecting especially poor and marginalized communities. In addition, the actions that we need to take to tackle climate change are also good for health. So if we think about, for example, a protein transition, so for example, moving to a more planetary health-focused diet, could potentially reduce the global burden of disease, including things like heart disease, by a quarter. And also decreasing the use of cars and switching more to public and active transport can have huge benefits for decreasing obesity, improving mental health, and as does, for example, another good mental health example is improving green spaces in cities, because that also, it helps to reduce the heat island effect, so you have less strong heat waves, but it's also really good for people's mental health. And you know, we've seen that during COVID-19, that the green spaces are really important for people. So yeah, so that's the two framings with which to think about it. And if you go to the next slide, I'm going to give you a couple of examples. And actually in our simulation later, we'll go through this in more detail. So here are some examples, and these are like genuine arguments that I often give to people that I work with and policymakers about why you should do these things anyway. So for example, active transport, as we said, more physical activity, reduce heart disease, reduce obesity and depression, clean energy, much better pollution-wise, really good, better for cardiovascular diseases, planetary health diet we've touched on, really good for decreasing lots of metabolic diseases. And we won't go into this in lots of detail, but climate smart healthcare is a really interesting concept, because obviously we have locked in lots of the impacts of climate change already. And we need to make our health systems prepared for those. But what we can also do is we can make our health systems better and more resilient to any crisis. We've seen from COVID-19 that our health systems are not ready to weather crises. And as we get them ready for the effects of climate change, we can also make sure that they reach more people. Does anybody have any questions on either co-benefits or, yeah, exactly. Please do feel free to ask us anything in the chat. And yeah, and don't worry about taking loads of notes. I'll send this out to everyone who registered afterwards. I'll send out the PowerPoint as well. Yeah, so if anybody has any questions about either the impacts of climate change on health or the co-benefits, please do pop them in the chat before we go on to our first interactive exercise. Otherwise, I will hand over to Omnia to do the next bit.
So thank you so much. So now you've seen how, we're using health from two perspectives. One, through the health impacts that we are seeing, but as well as the health co-benefits, which really presents a powerful advocacy tool to decision makers in the climate space. So we're equipping you with our health weapons in order to drive ambition to climate change and for countries to really increase their commitments and reduce their carbon emissions. So as you all know, as now we could have been in COP26 in Glasgow, but nevertheless it has been postponed. But this now really presents an opportunity for us to bring in health more than ever from now until COP26 in 2021 in Glasgow. So as you all know, during the last 2 weeks, there was the United Nations Framework on Climate Change. They organized the Race to Zero dialogue, which is basically a series of dialogues trying to mobilize leaders and different sectors from around the world, not just the health sector or the climate sector or the finance, but a multidisciplinary dialogue between leaders and as well as political leaders, but also NGOs and different civil society stakeholders to discuss how we can race to zero carbon. And also the COP26 presidency, they announced the 5 main priorities they want to work on, which is adaptation and resilience, energy, nature, transport, and finally finance. So this brings us to our first activity, and we want to hear from you after you reflected on the health impacts, but also the health co-benefits to working on climate change. So we're going to explore the first priority according to the COP26 campaign, which is adaptation and resilience. And as you all know, or now you're familiar with what is climate adaptation, and this is, trying to adapt to the climate change impacts and trying to minimize the negative implications that would lead due to the already increasing climate change impacts we're seeing. So the aim of the COP campaign when it comes to adaptation and resilience is to really encourage political ambition, finance, coordination, and investment in order to adapt in a stronger way and a more resilient way. And COVID-19 now has shown more than ever that we need to be more resilient. So I want to ask you, how do you see health, supporting this aim? How do you see health linked with adaptation and resilience? You can unmute yourself or you can type on the chat, but I would give you 1 minute to think about this and let me know how health can support the first COP campaign aim.
Great, yeah, so I'm going to start the timer and you'll have 1 minute to think about how adaptation and resilience is related to health. And when you've thought of something, you can either unmute yourself and say it, or you can type it in the chat. And your minute starts now.
can tell the first thing that comes to mind when you think about health and adaptation.
We've got
Okay.
20 seconds left. Sorry, Omnia.
No, it's okay. We already have one, and I will invite him to unmute himself. Okay, we have two right now. Anyone else wants to add?
Okay, your minute is up, so please post whatever you thought of in the chat, and don't worry if it's finished or not, but if you can all put it in the chat, then we can compare it. Thank you.
Perfect. So Terry, I would like to invite you to unmute your mic and tell us about your thoughts.
Yeah. I go?
Yeah.
I mean, I guess that, yeah, as you said, the COVID situation's really shown how vulnerable we are to supply chain disruption in particular. We have this kind of globalized, interconnected society, and then we decide, for whatever reason, that we can't do that anymore. Then we suddenly become very vulnerable to providing the sorts of services that we normally expect to be able to easily provide suddenly become impossible, or at least much more rationed. And then the other point I made around, so supply chains is perhaps the first thing that comes to mind for me, particularly resilience. And then the other ones about inequality is obviously the people that tend to get affected tend to be the people who are already disadvantaged, and it only accentuates those divisions. So if we're talking about adaptation, then we need to kind of shore up those mechanisms which reduce the level of inequality in society.
Yeah, thank you so much for sharing.
Sure.
Yeah, and I also see Terry said social prescribing by GPs. Would you like to tell us?
Yeah, I'm here.
Yeah.
Okay. I attended a session, I think it was yesterday,
Yeah.
where a report from McKinsey was shown that dealt with all these aspects. It was really very interesting. And part of it was pushing the idea of social prescribing, which is GPs, general practitioners in ultra-local areas, prescribing things for people to do to either improve their health, to improve their health, or to maintain their health. And the organisation behind that in the UK is the new National Academy for Social Prescribing.
Yeah.
You know about that? You keep saying yes.
Yeah, no, I understand what you said, and I really loved how both you and Alistair touched upon a very important sector within adaptation, which is one of the things that we wanted to highlight in our campaign, which is the healthcare system. So one very important element, or a center point of both your interventions, is how we can build resilient healthcare systems that are able to adapt, and as we can see now, can adapt to the pandemic, but also adapt to the future climate crisis. This is one important aim we can push for within the COP26 campaign. And another important thing when it comes to adaptation and resilience is building the resilience of our food systems, of our sanitation systems, which are now endangered more than ever in many countries that, as Alistair mentioned, are unequally impacted. And we need to build their adaptation and their capacities to withstand future either extreme climate events or other impacts related to climate change. So these are the certain links we're trying to integrate the health messaging in. And the second COP campaign aim, which is energy transition, and how do you see health linked with that? How can we further push countries to invest in renewable resources and net zero carbon solutions using the health argument? You will also have 1 minute.
Great. Yeah, your minute starts now. And yeah, please do put your thoughts in the chat, even if you're not sure. If we get everyone on the workshop putting their thoughts in the chat, we'll have lots of really good ideas. So please do put your thoughts in the chat whenever you've thought of this, about how the energy transition relates to health. You have 40 seconds. Okay, your minute is up. Omnia, do you want to look at what's in the chat so far?
Yeah. So Alistair told us about active transport as well as reducing air pollution. We also have Kara from France, who also addressed burning fossil fuel causes air pollution. So this is really fundamental, and this is what I've personally seen during the last 2 climate change conferences. The biggest advocacy that the health community is trying to push for, which is the air pollution, let's say the air pollution aspect, because as we said, we have very strong data and that presents an urgency to addressing air pollution. And I think now we are seeing how with the lockdown, there has been a tremendous, not tremendous, but a decrease in air pollution that we did not imagine we would be seeing before. We've seen blue skies in New Delhi, and I'm from Egypt, so I've seen air in Cairo bright and clean. And this just gives us, the hope that there is a need to breathe cleaner air, to invest in renewable energy that mitigates and reduces the number of people dying because of air pollution. So one of the health aims that are related to energy transition is reducing the number of deaths related to air pollution, investing in renewable energy, as well as, and this is also very important, coming from a health sector or any sector really, we need to think about the contribution of the health sector to air pollution. And we need to build resilient healthcare systems, as we said in the first campaign aim with adaptation, but also invest in environment-friendly healthcare facilities that have their own, or that reduce their own carbon footprint. And we also have Kumar talk about electric cars, biofuels, and wind turbines, which reduce the level of air pollutants. But also, it's interesting to think about the health risks related to their production and to their disposal. So it's kind of a cost benefit risk analysis that we need to think about when we're investing or suggesting renewable resources. So moving on to the next COP campaign aim, which is clean transport. And I know that Alistair touched upon that, which is, investing in or using active transport, which in a way promotes our health, as Rhiannon mentioned. When we're using cycling, then we're promoting our health and reducing the risk of cardiovascular diseases. But at the same time, we're making sure that our air is cleaner and we're reducing the carbon emissions by investing in active transport. So if anyone has anything to add related to clean transport, you can add it now in the chat if you would like. If you can think of anything else other than what we've discussed. I'm muted, sorry. Yeah, so more spaces in cities, that's also really important. And what's really, hopeful to see that during the last couple of months, we've seen many cities around the world, especially in Europe, for example, in Milan, but also in Latin America, in Bogota, Colombia. We've seen that their cities during the lockdown have transport. They installed many kilometers of cycling lanes, trying to create more spaces for active transport. So we are seeing this now. And I know that in Glasgow, in COP25, the mayor of Glasgow mentioned that they are also reshaping their own transport systems. And this is also very important. And I really like that Alistair touched upon that, which is reducing road traffic injuries. This is a very strong health co-benefit that we need to highlight when we're talking about transforming cities and promoting active transport. And it's also easier for people to get their jobs and access opportunities. It also, in a way, reduces the financial burden of having cars and the use of gas. So these are many health benefits we can use when we're talking about clean transport. So we have only two left. One of them is one of my personal favorites, which is nature. And one of the priorities for COP this year is trying to really prioritize not nature-based solutions, and really the concept of the multidisciplinary concept of planetary health, and how our health is dependent on the health of the environment, which sustains us. So how do you think, health can be brought in when we're talking about nature-based solutions and addressing the air, the environment that we are part of?
Okay, you'll have 1 minute again to do this. And please do post whatever thoughts you have in the chat. There are no kind of wrong answers in this, so just go for it. Okay, your 1 minute has started. Great stuff coming in, guys. Keep it coming. You've got, you've got 30 seconds left.
I had the same thoughts too. Health to be happier. Yes.
I like that. Very simple and direct. Okay, your minute is up. Please post your ideas in the chat if you haven't already. And Omnia, go ahead.
Yeah, so I'm really excited to read all of them. Terry talked about tree planting. Alistair talked about food systems resilience and crop diversity, which is really important because, as I mentioned before, one of the biggest health impacts we have is malnutrition due to crop failure. So this really presents a strong need for us to think about our agriculture processes and find out ways to diversify our crops and boost biodiversity. I would love to quickly share because I just discovered this organization in Indonesia actually, and they've been really trying to promote the concept of planetary health, and they were doing workshops to train farmers how to use a permaculture method, promotes resilience and promotes biodiversity and helps them promote sustainable agricultural methods. So it was very interesting to see such small development programs pushing for that. And this is an example of the kind of nature-based solutions COP is aiming to promote, and we can also push for from a health perspective. I know Dana mentioned regenerative farming or agriculture, mental health, and this is really important. That the concept of promoting planetary health is also eminent to our own mental health, and it's really a win-win intervention at the end of the day. And then there's also tree-lined streets are linked to less cases of bullying and domestic abuse. This is very interesting. Diana, would you like to elaborate?
Hi, can you hear me?
Yeah.
Yes, so this is actually something that I was kind of looking at. So I attended another mock COP fringe event, which was on rewilding and the co-benefits. And it was really, really interesting. And some of it links to some of what we're talking about here today as well. And it was interesting to learn, like, sort of what happens if you have like more like sort of nature on like some streets in comparison with others, and how that's like linked to people's sort of like mental health and physical health. And of course there's things like you know, reduced sort of air pollution on streets that are sort of lined with trees, but there's also like less sort of crime as well, less domestic abuse, less bullying in some cases as well, according to this talk that I was listening to, and that people's mental health as well as physical health is generally better. But of course, you know, when you look at the sort of streets that do have more nature and that are in this case lined with trees, that's not all streets. And so, you know, again, it's exacerbating inequalities in the way that some places have this kind of more nature and and the sort of then, you know, the inequalities that's exacerbating as well. Does that make sense?
Yes, no, thank you so much for sharing. I think it's really interesting. We're also learning from you a lot, and it's a very interesting way of perceiving streets that have more green spaces and how it really impacts mental health. So thank you for sharing. We're going to go to our final campaign aim, which is predominantly the most important, which is finance. And this year, COP is really thinking about how finance and how, you know, now countries are recovering, they're restarting their economies. So we're trying to think about, and this is one of the, you know, this shared agenda that countries need to have in terms of recovering in a more greener, sustainable way, and to increase the investments dedicated to climate action and commitments. So I think now, and there are many experts really refer to how with the pandemic, health can now present a strong economic argument. So how do you see health interlinking with finance in the perspective of the COP campaign aim?
Do you want me to give people a minute to do this as well, Omnia? Yeah, okay. Okay, think about how going green finance can help health as well. You have just under a minute. Okay, your minute is up. Please post any ideas you have in the chat if you haven't already, and Omri will take us through this final exercise.
Perfect. I wanted to share, Kumar added an input, I think, from the last one, which is very interesting for me to share, because he was referring to pharmaceuticals that are derived from plants and animals, and this presents a need to preserve biodiversity as well. So it's really, it's very interesting, and thank you for sharing. Now when we're talking about finance, so Rhiannon talked about how when we're investing in harmful industries, we're reducing the negative health impact of such industries, which means in a way we're also reducing the health costs that we need to pay when we are suffering from such harmful impacts. So this is one way of addressing finance. Another interesting thing by Janet, who highlighted food security and incentives and support to farmers, as well as ensuring proper supply chain for farmer to buyer. So this means we also need to invest in sustainable and resilient food systems by also supporting farmers and building their capacity. There's also a very important aspect that Clara highlighted, which is investing in more resilient health systems. And now more than ever, we need to invest in health. And it makes most sense to invest in resilient as well as environment-friendly and sustainable health systems. And then investing in our health system makes them equitable, as well as reducing the healthcare costs that are incurred by leaving no one behind, and financing healthcare packages for everyone. And then our final intervention is by Alistair in terms of funding climate initiatives with health co-benefits. And this is very interesting, which is putting a cost to the potential savings that we are going to help countries save in a way. And I think this is one of the things that I'm always very curious to know about and to see the studies. And as we all know, in around 3 or 4 days from now, the Lancet Countdown report for climate and health is going to be released. So keep an eye on that, because it's also going to talk about the potential savings, but also not funding pollution, not funding weapons, and pension investments, as well as peace of mind. So these are very interesting. And one interesting note you will find on this diagram specifically, that finance is cross-cutting all these 5 campaign aims. Degrowth can also have positive effects on our mental health. This was by Diana. Thank you for sharing. This is true, and I absolutely agree. And what the health community wanted to specifically focus on in many of your interventions that you mentioned, which is resilient health systems, value gains from carbon mitigation and adaptation policies, and very important thing, which is providing subsidies to invest in renewable energy and divest from fossil fuel. And this really empowers the point that was made by Alistair, which is trying to quantify the savings and the health cost savings from investing in net zero carbon solutions. So thank you so much for sharing. And now I'm going to leave the floor to Rhiannon to try to bring in this global perspective more into a local context.
Great. Yeah, so thanks so much, Omnia, for talking about the aims of COP26 and how they overlap with health. What we're going to do now is we're actually going to put you into some breakout rooms, and you're going to do a brief exercise for a few minutes, and then you're going to come back to the main room. So what we want to do now is think about how you translate these health benefits to the local level. So whilst these international climate agreements are essential for building consensus and stimulating action, a lot of the policies that are going to be the make or break are made at the level of a local council or a state or a district. So we're going to have a quick simulation, and what I will do is I'll put you into breakout rooms of 2 or 3, and you'll have 5 minutes, maybe a bit less, we'll see how we go, to put together a pitch to a local councillor, and it only has to be 2 lines. So the first line, so I'm your local councillor, so I'm in charge of actually I'll put this in the chat. These are the things that I am in charge of as your local councillor. So just so you know what kind of things that local councils have power over. So new housing developments, road design, bus services and cycle lanes, parks and green spaces. I've been given a grant from the central government to spend some money on the energy sector. I can change what I buy as the local council, and I also control the waterways. But I really don't want to act on climate. I don't think it's going to affect my community, and I can't really be bothered, and I think it's going to cost me quite a lot of money. So I don't really want to implement any climate change policies. So what I want you guys to do is I want you to strengthen your argument with a health argument. So I'm going to put you into groups of 2 or 3, and I want you to come up with 1 policy that you want me, your local councillor, to implement, and 1 health reason why they should implement it. I've given you some clues on the screen, and hopefully after our exercise you should be able to do this no problem. Yeah, so I'm gonna pop you into breakout rooms. Does that activity make sense to everyone? So you just have to have 1 line what your policy intervention is, 2nd line at only one health reason why I should do it, because I really care about health. I just don't care about climate change. As your councillor, I just don't care. So I need you to persuade me. So I'm going to put you into breakout rooms, into groups of 2 or 3, and you're going to be there for a few minutes. And okay, you should be being invited to go. Hang on. Okay, Omnia, you're going to go into a breakout room as well. Hopefully that's okay. Okay, great. You should be being invited now.
That's the first time I've been in a breakout room on Zoom.
Oh, really?
How does it feel?
It's quite cool, a function.
Yeah. That's quite late in the pandemic to have had your first breakout room.
No, maybe I'm just not very popular. Yeah. It didn't work terribly well. We didn't have very good audio though, so we had to text chat.
Oh no.
That's Zoom for you.
Mm. Okay, I think, okay, no, we're not all quite back. I'll give the last group a couple of minutes. Well, hopefully less than that. Okay, I think we've got everyone back. Okay, I think we should have everyone back now. Okay, so we're gonna do, in the last couple of minutes, it would be great if you guys, if one person from your group could just present what you decided, just like 2 sentences, one about what you decided and one about the health reason why. So if you go to the next slide, Omnia, we can see some of the ideas that previous workshop participants have had on this issue. So does anyone want to volunteer to go first? Sorry, I know it's a little bit scary. Okay, actually I'm going to pick on people. Oh, Terry, okay, I don't have to pick on people. Terry, you go first.
Well, we were a group of 2, the host and me. So the only thing I've got to offer really is what I've been harping on for a little while, which is that we need to bring it more into the community, so that the community, and you intervened, didn't you, in our meeting, and talked about citizen assemblies and so on, mini citizen assemblies, to take responsibility for co-production, etc. But I don't think we should keep turning to even the lower tiers of government, like parish councils, who are cash-strapped, as are the district councils, local councils. And we should take it more on the community to do it. But for the community to decide what it feels is important. This business of GPs, general practitioners, each GP, I think it's still by law, has to have a patient's participation group. It's a volunteer group. And it's those patient participation groups that I suspect will be talking to the link officers about taking more responsibility for developing ultra hyperlocal, if you like, activities as part of tertiary health service provision, if that makes sense.
Yep, perfect, thank you. Does anybody else from a different breakout room want to give a very brief introduction of what they did?
I'll try and do for ours. We basically wanted to target reduced air pollution, particularly traffic, and we had a couple of different ideas about how you would do that, but to try and be probably a bit too smart, we suggested maybe we could implement road user charging, which would also raise some money, and that might be a way of reinvesting in, either electric public transport or cycle lanes or some variation thereof.
Nice. Palois, do you want to tell us what your group came up with?
Okay. Well, various proposed policies to address potential human-caused climate action includes limits on carbon dioxide emissions from oil, coals, and natural gases. Because as we are in Pacific, I'm representing the Pacific, so well, basically reducing all this would also reduce the impact of climate crisis that currently we are facing. So yeah, by having a limit on carbon dioxide emissions from oil and coals.
Yeah,
so, yes,
I like that.
I think it would be one of the solutions that I think we should come up with.
Perfect. And the last group is either Clara or Mehedi. Do either one of you want to unmute and just say what you came up with?
Yes, of course. So we were talking about urbanization planning because in Bangladesh, for instance, it can be very chaotic. And our first argument would be related to the COVID pandemic, because if the urbanization is planned, then it could reduce the proximity between people, so reduce the contamination.
Interesting. That's a really interesting one. I like that. Okay, so final slide before we say goodbye. And yeah, as I said, we'll be sending out this slide to you so you can have all the resources at your fingertips whenever you want. So Omnia, if you go to the final slide. So on the as a kind of like last note is to kind of an action call to take this away to the national level in your countries and get involved in campaigns to get your countries and your governments to implement, say, for example, better nationally determined contributions, greener COVID-19 recovery packages, and yeah, just a plea to really get involved in any campaigns or any organizations who are trying to lobby your national government to implement better climate policies. I've put 2 examples on the screen, and there's links to them in the notes from the PowerPoint, which you'll get afterwards as well. 2 really good examples in the UK. The first one, the one with the 10 icons, is the 10-point plan produced by the Climate Coalition, who are a group of organisations in the UK who push the UK on their climate policy. And it includes things like protecting nature in the UK, but also making sure that the UK reduces their own emissions without exporting them to other countries and without damaging ecosystems in other countries as well. And the second example, which is the yellow box, is the demands of Green New Deal UK. I'm sure lots of you have heard of the concept of a Green New Deal in Europe and in America. And yeah, hopefully globally as the movement grows as well. So I just put on the screen for you the 5 demands of a Green New Deal. And I would really recommend looking up the work of Green New Deal UK, who are really great thought leaders on this issue in Europe. That's it from us. Thank you so much for joining us. Hopefully it's been a useful session. And yeah, please do get in touch with either of us if you want to carry on the conversation, or if you have any follow-up questions, please don't hesitate to do that. Let me just put my, I'll just put our, actually, that's my Twitter, and this is Omnia's Twitter. And you can just drop us a message. Oh yeah, that's a good one. And then my email is, that's my email as well. So just take our Twitters and our emails and get in touch if you want any help or on this topic, or just want to keep talking. But yeah, thank you so much, everyone. Have a lovely rest of the mock COP. Yeah, and congratulations to all of you on the great work you've done so far at the event.
Goodbye, everyone.
Thank you, everyone. Bye.
Bye.